download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. NTA has reopened the window for submitting online application form for NEET UG 2023. The registration window is open till 13th of April up to 11:30 p.m. The last date for receiving fees online is 13th April up to 11:59 p.m. NTA has received representations from the candidates to open the registration window again for applying for NEET UG 2023 as they could not complete the registration due to various unavoidable reasons. In view of supporting the students' community, it has been decided to reopen the registration for receiving online application forms. Noting the direct and pernicious impact of smokeless tobacco on public health, the Delhi High Court on Monday affirmed a ban imposed by the Food and Safety Commissioner on manufacture, storage and sale of gutka, pan masala, flavoured tobacco and similar products in the city. A bench headed by Chief Justice Satish Chandra Sharma set aside a September 2022 decision of a single judge of the High Court quashing the ban and allowed the appeals filed by the centre and Delhi government against it. The court opined that there existed no justification for the quashing of the notifications and dismissed the objections raised by entities in tobacco business against the prohibitory notifications issued from 2015 till 2021. A court of the Public Health and Family Welfare Ministry has now provided interim relief to Seawoods-based NeuroGen Brain and Spine Institute by staying the deregistration notice issued to the institute by Navi Mumbai Municipal Corporation. Apart from issuing a stay against the concerned deregistration notice, Public Health Minister Tanaji Sawant slammed Dr. Pramod Patil and cancelled his deputation to NMMC as the Medical Officer of Health. Besides, the institute has also sought to file an FIR against Dr. Patil. The concerned deregistration notice had been issued by NMMC as it alleged that NeuroGen was illegally conducting and advertising stem cell therapy for autistic children for lakhs of rupees. Adding menthol flavoring to electronic cigarettes may damage your lungs more than regular e-cigarettes do, a new study reveals. The common mint flavoring helps deliver lots more toxic microparticles compared with e-cigarette pods that don't contain menthol. It's those microparticles that damage lung function, researchers say. To look at the potential danger of menthol, researchers developed a vaping robot that mimics the temperature, humidity, puff volume and duration of vaping to predict lung damage from e-cigarettes. The system measures the size and number of aerosolized microparticles and how they act depending on what's in the liquid. The effects are tested on a so-called lung-on-chip device that calculates potential toxicity. So we found that there were more toxic microparticles emitted with menthol vaping liquid. This latest study, published online in the Journal of Respiratory Research, suggests that menthol additives could be as dangerous as vitamin E acetate, the researchers noted. Denying any relief to the Mumbai-based hospital, its orthopaedician and anaesthesiologist from the charges of medical negligence, the NCDRC has upheld more than 12 lakh compensation to the family of a senior citizen patient who did not regain consciousness due to excessive use of anesthesia during surgery. In its order, the top consumer court ruled that though negligence was attributable to the anaesthesiologist who passed away a few years ago, the hospital shall not be absolved from vicarious liability. Moreover, the orthopaedician who was leading the procedure has been directed to pay his share of the compensation as before proceeding to surgery, he was supposed to be careful to ascertain proper pre-anesthetic checkup and fitness report.
Adding mint flavor to e-cigarette liquids produces more vapor particles and is associated with worse lung function in those who smoke, report researchers from the University of Pittsburgh in respiratory research. Using a specially designed robotic system that mimics the mechanics of human breathing and vaping behavior, researchers showed that commercially available e-cigarette liquids containing menthol generate a greater number of toxic microparticles compared to menthol-free juice. An accompanying analysis of patient records from a cohort of e-cigarette smokers revealed that menthol vapors took shallower breaths and had poorer lung function compared to non-menthol smokers, regardless of age, gender, race, past years of smoking, and the use of nicotine or cannabis-containing vaping products. An emulated randomized trial performed using observational data from more than 43,000 adults with primary hyperparathyroidism found that parathyroidectomy had no estimated effect on long-term kidney function in older adults when compared to observation. However, early parathyroidectomy may preserve kidney function in patients younger than 60 years of age with primary hyperparathyroidism. Researchers from the Stanford University School of Medicine studied for 3,697 adults diagnosed with primary hyperthyroidism to compare the incidence of a sustained decline in estimated glomerular filtration rate of at least 50% for those treated with parathyroidectomy versus non-operative management. The researchers found that the weighted cumulative incidence of a sustained estimated glomerular filtration rate or eGFR decline of at least 50% was 5.1% at 5 years, regardless of how primary hyperparathyroidism was managed. In the overall cohort, there was no difference in the adjusted rate of a sustained decline in eGFR among patients treated with parathyroidectomy versus non-operative management. However, subgroup analysis indicated that the patients younger than 60 years treated with early parathyroidectomy were more likely to preserve long-term kidney function. Over the past few years, the Department of Family Medicine and the Department of Psychiatry in UNC School of Medicine have been working together to spearhead the development of a new enhanced primary care model to provide better primary care for patients who have severe mental illness. A new analysis led by Alex K. Gertner, a psychiatry resident at UNC Hospitals, has added further evidence that the new model is effective. Gertner found that the enhanced primary care model resulted in lower hemoglobin A1C and blood pressure for patients with severe mental illness when compared to other primary care clinics throughout the state of Northern Carolina who do not use the model. Research led by scientists at UCLA Johnson Comprehensive Cancer Center found that responses to a type of immunotherapy called PD-1 checkpoint blockade in patients with advanced melanoma dependent on whether or not they had previously received another immunotherapy, that is CTLA4 blockade, as well as other factors. Their findings, based on analysis of 7 data sets generated over the past decade, which included results of tumor biopsies from more than 500 patients, are published in Cancer Cell. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.